got a couple of minutes left, so
Okay.
Can they hear us?
yes.
Yes.
Okay.
So Kathleen, I think, I'll speak and then you'll speak and then we'll take questions and we'll have Julia sort of ask the questions. That seem fair? And she'll alternate, either I'll answer or you'll answer, and then we'll go back and forth, but either one of us can join in whenever.
Okay. That works.
And we will keep this to 1 hour. Julia, for housekeeping, we can say that a video will be up on my YouTube page. That'll be after the event, right?
Well, folks can jump on to your YouTube right away, but
Okay.
they won't need to do that if they can get into the Zoom town hall.
Okay.
But yes, it will be there also
So if
afterwards.
they can't get into the Zoom town hall, they can go to my YouTube, and that's Barbara Favola. They could just figure that out, right?
And I'll also put it in the chat.
You can put it in the chat. Okay, all right. Now, Kathleen, is this being sort of thrown to your Facebook page? Oh, I don't know.
Call me back. I'm sorry.
So is this going to be on your Facebook page?
I don't know. I don't know how that works.
Okay. All right.
Would I have had to have someone do that?
I'm not sure.
Yeah,
how are
that
you-
needs to be connected, but we can provide you with a link to the recording that your aides can then put on your Facebook page, but it won't be broadcast live there because the senator's Zoom account would need to be connected to your Facebook page ahead of
It's
time.
complicated when you do my account. but
I
you-
didn't know anything about that, unfortunately, or I would have had him do it before he left.
That's all right. You'll have it. You'll be able to put it on your Facebook page
After, it's fine.
after. Yeah, and actually, I've always gotten more hits after than I have during. Go figure. I keep getting these messages. Are you sending me messages or just coming in from? Okay. So we're going to be ready to start at exactly 5 o'clock. We ready?
Okay, that time is now.
Okay. All right. Well,
Senator Favola, Delegate Murphy, you're ready? Okay.
Yes, we're ready.
okay. Welcome to those of you who are joining us this afternoon. I'm Senator Barbara Favola. I represent the 31st Senate District, and that includes a large portion of Arlington. The district also goes up the river, so I have parts of McLean, all of Great Falls, and I do have 6 precincts in Loudoun. And I've represented the 31st Senate District since the 2012 General Assembly session. I was elected in November of 2011. I chair the Rehabilitation and Social Services Committee, which has oversight over the operations of our jails and prisons. We also look at safety net programs, those programs that are necessary to support our women and children who sometimes are re-entering society because they have been incarcerated or they're facing severe poverty. My committee also looks at foster youth and how to create a really good safety net under foster youth so they can thrive and succeed. And then lastly, the Rehabilitation and Social Services Committee has oversight over the Alcohol and Beverage Control Authority. And if we move towards the legalization of marijuana, that bill is on the governor's desk. The Cannabis Control Authority would fall under Rehabilitation and Social Services. I also sit on transportation, local government, the Environment and Agricultural Committee, and also the Rules Committee. I am a Democratic whip in the Senate, and I chair the Women's Healthcare Caucus. So I'm a busy woman. I will let Kathleen Delegate Murphy introduce herself, and then each of us will talk a little bit about the legislative session, and then we will address questions. Many questions came in before the meeting, which was good. We appreciate that, and we're able to do our due diligence so we can have good, comprehensive answers for you. And my Chief of Staff, Julia Chun, will be the one posing the questions to us. Thank you so much for joining us. Delegate Murphy.
Thank you, Senator Favola. Hi, I'm Delegate Kathleen Murphy. I have been a delegate in the 34th District for the past 7 years. My district is McLean, Great Falls, and parts of Loudoun. I think I have 7 precincts and Barbara only has 6. I am the vice chair of the Transportation Committee. I am the vice chair of the Democratic Caucus. I serve on general laws and finance committees. I have started the Gun Violence Prevention Caucus, which is both the House and Senate caucus. Adam Evan is the representative who started with me, and he's a senator. I started the Rare Disease Caucus because so many parents had come to me with problems getting medical coverage for rare diseases that their children suffer from. And we have a daughter who has cystic fibrosis, and I'm very, very aware of how difficult these things can be. I also serve on the Veterans Committee for the Commonwealth, and I created several. I've had about 11 roundtables for our women veterans and got funding for a women veterans coordinator for the 107,000 women veterans across Virginia. So I'm looking forward to this conversation, and I thank all of you for being here because it's very important to us to hear from you. So I'm looking forward to hearing from you this evening.
We'll give you each of us will give you a brief overview of what the General Assembly accomplished in this last session. It was a very quick session. It was 46 days. And the Senate actually met in person in the Science Museum in Richmond. We were socially distanced and wore our masks, and our temperature was taken every day. But the House of Delegates met virtually, which was interesting dynamic.
Now we stayed at home on our computers and our big screen computers, and
it was
just too many of us to find a place to put us.
Yeah, 100 is very different than 40, and so it was a different session for for everybody. Public comment was done virtually, and folks signed up. Our meetings were through some type of virtual venue. We use Zoom a lot in the Senate. So there were both pros and cons to that. Some folks felt it was easier to be able to participate in committee meetings without having to travel. They certainly felt a lot safer. But I will say we also experienced some technical issues oftentimes. So folks who thought they were going to get into the Zoom chat room or who thought they were going to be given an opportunity to comment sometimes did not. So my apologies for that. We did try our best. And of course,
even worse, Barbara, I mean, even worse was when we had to be in 2 places at the same time.
That was a challenge, yes. But at least we weren't traveling there. But that was a challenge. And of course, stakeholders and lobbyists who would normally be roaming the physical building that we were in were not allowed in the Science Museum. So very different context for this General Assembly session. Nonetheless, we, by any measure, I think folks would say we accomplished a lot. We achieved a lot. Some of the landmark legislation, we repealed the death penalty, which I personally was very proud of because for several years I had carried a bill to repeal the death penalty for those who were seriously mentally ill. at the time they committed the crime. And for one reason or another, the bill always managed to be defeated. So this year to have a clean repeal was really heartening. And it puts Virginia the first state in the South to take such a dramatic step in criminal justice reform. So that was really, in my mind, it was a very heartening and a very good move for the state. The other big issue that I'm sure everybody has been reading about has been the legalization of marijuana. That started off as a 500-page bill, and it did come through my committee, and it also was heard by the Judiciary Committee. And then it ended up in finance to sort of put the final touches on. But the bill it started off as a proposal from Governor Northam, and the Rehab and Social Services Committee changed it considerably. We had about 10 hours of testimony. I had a subcommittee established, which was chaired by Senator McPike, and they took 8 hours of testimony, and then the full committee heard 2 hours. And we determined that there were several priorities that were extraordinarily important to us as lawmakers and as folks in charge of the welfare of Virginians, and also being very cognizant of social equity issues. So we determined that a new agency, a cannabis control authority, was the best way of moving forward. In the Senate, we decided, and this prevailed in the conference report, to continue to decriminalize 1 ounce of marijuana, a possession of 1 ounce or less. So right now it is only a fine of $25, and it is not a crime. It is a mere civil offense. And we also decided that having an automatic expungement right away of any criminal record of an individual who may have possessed 1 ounce of marijuana or less and was slapped with a felony because the offense happened prior to the decriminalization, that record would be automatically sealed or expunged from public view. And there was a lot of consensus around those issues. We also felt very strongly, however, that we needed to establish a structure that would regulate marijuana, the cultivation, which would be the growing of marijuana, the distribution of marijuana, and then the retail sales of marijuana. So to do that, we decided we needed a reenactment clause, and then we also felt that legalizing marijuana should not take place until we have the regulations in place for, again, the cultivation, distribution, and retail. So right now, the bill would have everything become available and legal January 1, 2024. I don't know what the governor's going to do. Certainly, there were lots of views about how we should move forward and when we should legalize it. But I will say that, and I'm very proud of this, the Senate as well as the House spent a lot of time articulating principles of social equity while we were creating this new market. So, communities of color and entrepreneurs of color who traditionally have been very disadvantaged. Communities of color have been over-policed with respect to the use of marijuana. Our studies show that Black and brown people do not use marijuana at a higher rate than others. In fact, their usage is the same, but they have been over-policed and over-arrested for that. And we wanted to make an effort to acknowledge that and to say that now it's time to share some market benefits when this drug becomes legalized. So that's sort of in a nutshell, the legalization of marijuana. I don't know exactly what the bill will look like when the governor signs it, but I know that something will come forward, and we will be able to proceed, hopefully in an organized fashion, so we can protect everybody, ensure that the use of marijuana stays with adults 21 years of age or older, and that the revenue we receive from marijuana is used for very worthwhile things like early childhood education, and a third of the money will go for substance abuse prevention and treatment. So
Marijuana legalization, though, has gone on in Colorado and California and other states. So I'm glad to see that it isn't going to destroy lives from this point forward.
No, we are going to be very thoughtful and very careful about that. It's my personal agenda. I worked on a pregnancy care bill. So I asked the board of local and regional jails to convene a stakeholder group to ensure that care provided to women who are pregnant in our regional and local jails, both the prenatal, the delivery, and postpartum care meets the standards of the College of Obstetricians and Gynecologists. So I think that's a really important thing to move forward. I did remove some old language that stigmatized access to mental health services. So I feel very good about that. Our state facilities, prior to my bill going to the governor, my state facilities were still required to ask the immigration status of individuals seeking mental health services. And hopefully the governor will sign my bill, which repeals that. And no other access to healthcare, no other healthcare service do we ask in immigration status. So that was a very big deal to the disability community and some of the Justice Forward groups. I also worked on a clean energy plan, which was an administration bill, and it really memorializes some very important principles in how the state will move forward and how we will transition to renewable energy. So the bill talks about environmental equity, it talks about transitioning to renewable energy, and the workforce development and economic angle for getting there. So that's really important. I was proud to assist my cohort here, Delegate Murphy, in working on removing firearms from those abusers in a household setting where there was a conviction of an assault and battery misdemeanor. Delegate Murphy's bill passed the House. It was a strong bill, and she worked very hard on it. My bill, which was the exact bill, did not pass the Senate. So when Delegate Murphy's bill came over to the Senate, I worked with some lawmakers on the Judiciary Committee to make some amendments so we could get the bill out. And the biggest change we made is the firearm would be removed, but the firearm right could be reinstated in 3 years. So we'll see how that goes. But I really thank Delegate Murphy for her leadership on that bill. And then a couple of other things that that I covered, or I should cover for you. The reopening of schools. The governor has, issued a statement asking schools by March 15th, all school systems, to have a dual program where there is some in-person learning and they can continue with virtual learning until an appropriate time where the school boards believe that every CDC practice can be implemented, parents feel completely safe, and the schools can open full-time in person. We did put money in the budget to promote summer school. We are aware that some students are falling behind, some students are thriving with virtual learning, but some are falling behind. and we need to provide an incentive to make sure that our students do catch up. And we want to be supportive. The state needs to be supportive of school systems so they can serve their communities in a way that assists parents, so parents can work as much as they need to, so the economy can reopen, and our students can thrive. So I'm pleased to say most school systems are providing services for some in-person services for children, the K through 3, and the special needs children, which is really important. In terms of vaccines, Virginia has moved into the 1B category, which is really great. And we are ranked 7th in terms of the proportion of Virginians getting vaccinated. So we are getting the vaccines out. Fortunately, the federal government has increased our supply, and our local public health departments seem to be mobilizing volunteers and actually getting the shots in people's arms, which is really good. The budget was more positive than we expected. There will be state dollars available to school systems for teacher pay increases. Of course, the local match will still be required, but the state has put in enough money so teachers could get up to a 5% pay increase, but the local governments would have to also put in the match, which will be quite expensive for some governments. Let me just see if there's anything else. Lastly, the other big piece of legislation that passed, which I think is landmark, is the electric car standard bill passed. So by 2024, so for vehicles, the 2024 models will have to meet a clean emission standard. And over time, we're going to get to a zero emission standard for our cars. We think this is a big step forward. 14 states are working together to come up with what these clean emission standards should look like. Again, Virginia was the first state in the South to pass this clean electric standard bill for vehicles, and I feel pretty good about it. I was chief patron of this bill in the Senate. So I will stop now and turn the forum over to Delegate Murphy. I'm sure she could tell us plenty about what was going on in the House.
I don't know. I think you've covered almost everything. For sure, the 5% pay raise for teachers was something that was really important to all of us. You know, the teachers and all that they've had to go through has been difficult. We really are trying to get kids back in school. I did pass a bill that decreased the number of lockdown drills because we had heard from a lot of parents that kids were really traumatized by these lockdown drills. So instead of having 3, they'll have 2. And I think the youngest kids will only have 1. We did pass a bill too for the governor to provide a waiver of the accrual of interest in the event that there is a state of emergency. And I think that was important. I established a rare disease caucus. I know so many parents who deal with kids who have rare diseases, and it's not a caucus, it's a council. And they came forward and they asked me to put this in place because they really did need some place with the executive branch to bring their issues and to make sure that they were dealt with because of all the health challenges that they deal with. I am always very, very proud that I have been fighting for 6 years to pass this bill on taking firearms away from someone who's been convicted of assault and battery of a family member. It was a perfect bill, really, when it left the House. The Senate didn't see it that way, however. But It takes guns out of the hands of repeat, violent, convicted domestic abusers. However, the Senate decided it could only apply to people who had a child together.
No,
That
spouses or long-term
spouses or,
partners.
yeah.
Yeah, and
And
if
I
they had a
just,
child together, yeah. We
so,
took out the family, we took out children and,
yeah, you
yeah.
did.
yeah, I'm
Well,
sorry.
you didn't, but
I
the
did.
Senate did. And I was disappointed in that, but at least this is the first step. And we worked really, really hard. I do not understand why someone's right to have a gun is more important than the victim's right not to be abused. And I fought for that, and I will continue to fight down that trail. We put in money for summer school to run, summer school and try and help kids catch up. I think that's going to be really important. And I serve on the Board of Veterans Services, and I was really, really proud that we were able to get a second women veterans coordinator this year. Something Jennifer Wexton, Congresswoman Wexton, and I have worked on for a number of years together. So I was really, really pleased that could take place. We also concentrated on getting funding for affordable housing and for the expansion of broadband. So those were two issues that I was very involved in. We did a whole lot more, but a lot of it is exactly what Barbara had been talking about. So I think it's time for us to hear from the people in the audience.
Yeah, thank you, Delegate Murphy. And there certainly is more to say, but I think her suggestion I think her suggestion about hearing the topics that our listeners are interested in, we will do our best to give you our insights and sort of give you a sense of where the General Assembly is on the different issues that have come through. So I will turn to Julia now.
And expanding voting rights, I think, was also something that was really important that we concentrated on this year as well.
Okay. There are a couple of things.
So we received a number of pre-submitted questions. And while we're on the topic, we did get one about voting rights. And I think this is a question that either Senator Favola or Delegate Murphy, if you want to jump in at any point. But the question is, if you can just explain some of the new voting laws and what's being done to allow voters to cast their votes in an accessible and secure way.
Well, I will start off. I put a bill in this past session that did pass, and what the bill does is it removes the witness signature on an absentee ballot during a executive order that's been issued by the governor for a public health emergency. So, so going forward, if there are future executive orders and we are under a public health emergency, we will have this on the books. And my bill also directs the State Board of Elections to convene a group of stakeholders to look at how other states have implemented mail-in voting. So I feel pretty good about that because 38 states have some form of mail-in voting. None of them have a second signature. So we're going to look at how they do it. I know Oregon has had a complete mail-in voting system for 15 years, and the Heritage Foundation, which is not a foundation that not everybody always quotes, but they did do an evaluation of the Oregon system and found, after looking at 15 million ballots, and I'm sorry, the word 15 comes up twice, but 15 million ballots, they found like a 0.16% or something of flawed, not necessarily fraudulent, but flawed ballots. So in conclusion, the Heritage Foundation concluded that there really was not any fraud associated with the mail-in voting process used in Oregon. So
Several states have been doing mail-in ballots solely for years. Oh, I think Washington State, I think Colorado actually as well.
yeah, it really in a much larger way than any of the states that are up here that, than Virginia's done. That is correct. So I think our goal as a society, and I think our lawmakers on both sides of the aisle, I would hope, would want to empower voters to be able to vote in a safe and accessible way and in a secure way.
Yeah.
We did move forward with the drop box this year. I believe, I think it initiated in the House where drop boxes now can be used going forward. And we found those to be very, very helpful to voters. Some folks didn't really want to put their ballot in the mail, but they felt better putting it into a drop box. So that I think that's a big step forward. It's incredibly important if you're going to have a working democracy to enable people to vote, to make it easy to vote. And again, you want to make it secure as well. And that seems to be the two guiding principles. And I think we're well on our way.
Well, the thing too that we did was the restoration of rights when people have committed crimes and they can return to society. There's the
An
restoration
automatic
of rights.
restoration of rights. Yes, in fact, the governor, I think, is going to move forward with that. He sent out a press release today. There was a constitution, there was the first pass at a constitutional amendment, passed both the House and the Senate, that would, permanently grant felons an automatic restoration of rights once they have served their time and they have been released from prison or jail. And I just think that that's a real important step. And I'm very glad that I was able to vote on that.
And we had a lot of good things to vote.
One of your constituents notes that Washington State has been doing mail-in voting for at least 20 years. So there's that. Our next question is also for either Senator Favola or Delegate Murphy. And this constituent asks how the COVID-19 vaccine rollout has been going, particularly for those who are maybe younger than 65 years old or have pre-existing conditions that aren't explicitly named. Can you talk a little bit about that?
Well, Dr. Avula is heading the state effort, vaccination effort. He, I believe, comes to us from one of the Richmond suburbs. Was it Henrico County that he was the public health director? And he has been on top of it. He has been providing assistance to the local health departments. From the Northern Virginia perspective, I have some good news. Early on, when the vaccines were still being distributed up here in Northern Virginia, a fair portion of our vaccines were going to contract workers who had top security clearances. They were working for the Pentagon or some of our intelligence agencies, and because they had top security clearances, they were under the continuance of governance category. So they were in the 1A, and we were happy to serve them, proud to have these workers in our jurisdictions. But they were, in fact, using our supply of vaccines. So the governor actually worked with Maryland and the District of Columbia to ensure that the DMV area got an increase in the supply of vaccines, because our workforce so proportionately had a lot of people who were under the continuance of governance category. I've heard that, here and there, there's some, stories. I wish I didn't have to address, and I feel very sorry about. But overall, folks are telling me throughout Northern Virginia, anyways, folks who have gotten their vaccines feel the operation has gone smoothly, that they were in an environment that was, they could socially distance. There were plenty of volunteers. People did the identity checks. People took their, vaccine card and then they got their shot and they could wait a few minutes after getting their shot. But I have only heard positive things about the way the vaccines have actually been implemented, and I'm very proud about that. Now, I have heard complaints that we're just not, people are anxious. They're not, they're anxious. They signed up. You could either sign up locally or you can go to the, and maybe you could put this in the chat, Julia, you can go to the Department of Public Health link to sign up, because that's sort of serving as our master list of everybody who needs a vaccine or wants a vaccine. So
I've talked to a lot of people, and everyone who has gotten the shot seems to have been really pleased with the way that it was handled in the system that they had to go through, and the waiting period after, and how careful everything was done. There have been some people who were able to get the first shot and were having some trouble following up with the second one, but we were able to help out and get them that second shot. But this, I'm not hearing from a lot of people that they've had a trouble getting vaccinations. I know the wait has been long, but I finally got my 2 shots, and it was a Moderna. And I can tell you my joints were all achy for about 3 days, but then I just came right out of it.
good for you.
So I think all in all, it's going well, but it is complicated. It is a long time to wait. And I know younger people are very stressed.
Yeah. So we're both here. If you need us, please contact our offices. I know I have asked the health departments, if at all possible, to notify people about where they are in the waiting list and when they can expect to be contacted. Because to your point, Delegate Murphy, it is an element, it is stressful to have registered and then to go weeks without hearing about where you are. So I'm hoping the public health departments have set up some type of notification. I've been told they have. I noticed there's a question on the bicycle. Is it bicycle safety? The bicycle safety bill?
I haven't seen any questions.
We set up a task force. We set up a task force to study some recommendations that came forward through a legislative proposal about bicyclists and when they can stay in one lane and when a car has to actually move to a new lane to pass them, and other elements regarding sort of bicycle safety. So I'm hoping the task force can come up with some solutions where everybody can buy in.
Okay. Delegate Murphy, did you want to add anything?
Well, I was just going to say, I got a lot of calls from people in the biking community saying they really like the fact that they can sort of view a stop sign in some cases as a yield sign. So they don't have to come to complete stops when there's no other traffic. And I'm not a bike person, just never have been. But I know that they thought this was a great step forward for the biking community.
Yes, yeah. So we're really moving towards a multimodal transportation backdrop, and I was on the conference committee for a bill that will direct the Department of Public Transit and Rail to study areas where transit is to study underserved areas with respect to transit and to come up with recommendations on how to improve the availability of transit. So we'll see how that goes.
We have another pre-submitted question, and this is a question, it's a workforce issue question about job losses and job retention. And maybe Senator Favola, you'd like to address this, but the constituent expressed her concerns for Virginians who lost their jobs during the pandemic. And she says that she heard that all state employees were able to keep working during the pandemic and wanted to know how that worked and what we can take away from that.
Well, I know that state employees were reassigned based on the need.
Reduced hours and reassignments.
Yeah, which is the appropriate thing to do. I know a lot of people were pulled in to the actual management of COVID, and that was very important. So, I mean, giving the chief executive flexibility to do that, and of course, he has that flexibility, and managers have that flexibility. COVID demonstrated why you need it, and Virginians were, I think, served well by having these, reassignments and reallocation of resources. Was there a second part of the question, Julia?
I think it was about state employees.
Yeah, I think the point is that the state employees were able to keep working, in a more limited way, and there were reassignments to be helping on the COVID. So it wasn't that they had to be laid off, and I think that's really what they worked very hard to try and ensure that people were able to keep their jobs, and we were able to meet the needs, the different needs, the expanded needs of our communities.
Yeah, I mean, we had high numbers, unemployment numbers. Certainly didn't need to add to that, to your point, Delegate Murphy. We had made $50 million available this summer to help renters meet their rental obligations, and that would also help landlords as well. So we absolutely needed a safety net. In a pandemic. You don't want more people homeless. That would be the last thing you'd want. And you don't
in people being pushed out of their apartments, that was put on hold for a while.
Right, we had eviction moratoriums. So we tried to do, I think we could have done better in some cases, but I think we did try to address the really pressing needs that our communities and our most vulnerable workers were facing. And again, these are folks with families and children who needed to continue with their virtual education and needed stability. So
it's every person who's listening right now knows that this has just been, I want to say, a nightmare of a year. And we have all had to find new ways to navigate, whether it's going to the grocery store and wearing a mask and gloves, or sitting with your children as they are going to school at home while you're trying to do your job at a different computer. I mean, there have been so many amazing problems that we've had to deal with. And in some homes where there was one computer for 3 kids, I mean, there have been a lot of remarkable difficulties that have been, people faced. And yet, we've been able to help in a lot of ways for people to overcome and for kids not to lose out totally on schooling. Although it's time for us to get these kids back to school, because this just isn't healthy.
I agree.
And because we're addressing the pandemic, there's actually a question in the chat box from Glenn. And he's saying that folks are having their second shots delayed. Why are second shots delayed, and what can we do about that? Do you have any information?
I don't have that information.
No, I mean, we're just, again, it's so much of it, I think, is the supply part of
Lines
the
and
part of the problem. Yeah, we need more vaccines. We don't seem to have a problem getting the vaccines that we have into the arms of people. So, because we've been analyzing the whole sort of process from sort of a management oversight perspective, and we are doing a very good job of getting the vaccines into the shots of people, but we could use more supply. And I don't
the
know.
nationwide supply we're dealing with. This isn't.
Yeah, I don't know what the federal government, what the plans are. I know Johnson and Johnson is coming out with a 1-dose vaccine, and that supposedly is available. So we're going to try and do our best, but I'm not sure we can control everything.
We had another pre-submitted question, and perhaps Delegate Murphy could address this. A constituent wanted to know what happened to House Bill 2325, and that was the Corrections Ombudsman's Bill. Do you have any information to share on that? And if not, we can take questions via email as well.
No, I would have to look that one up to see what it actually did. I don't know that one right off the 2, 3.
We have another question for both Senator Favola and Delegate Murphy about creating a task force or an advisory board so that young folks will have a voice in our system. So youth issues would be addressed.
Yeah. I think there are several of those already in existence. Just as an example, I think the McLean Community Foundation has members who are youth advisors on their board. A lot of places are starting to do that, and I know that for the governor there's a youth board. I'm not sure where all these kids come from because I know no one has asked me to look into it for them, but I know it exists.
And various school boards have student members, which is, a real great place for young people to sort of start their experience in policy and advocacy, especially since they were products of the public schools. So there are opportunities. I still serve on the Virginia Commission on Youth, and I chaired that body. But I'm going to take back the suggestion of maybe having a subcommittee of that group be a committee of youth. I know we have been consulting with foster youth rather, regularly because we're overseeing foster care legislation, and I was very proud to be able to get Virginia to finally participate in the Fostering Futures program, which will enable our young people between the ages of 18 and 21 who have exited the foster care system to be able to get support, continue to get support while they go on with their education or job training. So we really care about these young voices. I think it's great that somebody asked the question. We've got to get you more engaged. We've got to get you into all of our committees in one way or another. We really do appreciate the fact that folks want to get involved.
We have another pre-submitted question about the National Popular Vote Bill and what happened to that during session.
Well, I think it was introduced this year, and in the Senate, it's always heard in the Privileges and Elections Committee, but the bill did not make it to the floor. So, so that means it was.
Or did it make it to the floor in the House?
I think
And we can,
it's a worthwhile idea. I don't know the details.
Interesting idea anyway, to count all the votes instead of dividing it up between states. I mean, I think the reason that some of the states oppose it, like Delaware, is that they feel like New York and Illinois and California and Texas would probably always be the ones to decide who's going to be president for the whole country. And they don't like that idea. So that's really what has slowed this down year after year after year.
Yeah, it's really an interesting conversation, though.
It is, actually.
It's hard to say, it's hard to argue that, somebody who wins the popular vote shouldn't be president. It's a interesting conversation.
The ombudsman bill didn't pass the House, but that was based on how much it would cost.
Which one was that?
The
ombudsman bill. Yeah.
we also got a couple of questions about the Springvale Road Bridge and if there are any updates on that or your opinions on that.
Story on that bridge is they want to know whether it's going to be one lane, continue to be one lane, or go to 2 lanes. I haven't talked to anyone in the Department of Transportation to see which way they were leaning on that. I have heard from several constituents that they really want it to be 2 lanes, and I've heard from several others who say they want it to stay as 1 lane like it always has been. So it's pretty divided.
I've attended a couple, I'm sure you have too. I've attended a couple of Zoom meetings with VDOT and the Great Falls Transportation Committee of the Civic Association, the Great Falls Civic Association Transportation Committee. And I've had many briefings on the bridge. First, I'm excited that we're actually going to come up with a bridge that is safer. I think
that would be good.
And won't be subject to flooding and hopefully, and will be very attractive. But I do understand, at least in the last Zoom meeting I was on, many residents seem to voice concern about having the 2-lane traffic going either way on the bridge. I think
it's a path through from Route 7 to Georgetown Pike. They don't want that traffic.
Right. I think it'll be a very tough sell to get VDOT to back down on the 2-lane, but I'm certainly willing to advocate for the Great Falls Citizens Association. If they come up with a final position, I will advocate for that.
We also have a question from a constituent who's heard about some significant delays in getting unemployment benefits. Do you know if and how this is being addressed?
I can tell you I have staff on it every single day and they've been pretty successful in making sure that people are getting their benefits.
Yeah, Julia's been doing the heavy lifting for my office, and I guess she's on a first name basis with the state staff and the Virginia Unemployment Commission. And Julia, I want to thank you for the yeoman's work you've been doing. It's been great, and we appreciate that. In the last budget, the 2020 budget, we had added some staff to assist with processing, which I'm glad we did, because we definitely needed more staff. And sometimes things get tied up in an appeal and it takes longer than you might think. So if there's a specific issue or question, I would ask that the individual contact our offices and give us the specifics so we can then contact the Unemployment Commission regarding that specific case. Because I have found that every case seems to have a different nuance or a different angle or some different element to it. So it's hard to say, in a blanket way, what's going on. We're almost at the end, right?
We are almost at the end. And We have some questions in the chat box,
Can we
and I
only
think
take
we've
one more
gotten
que-
through.
Do you want to take one more question, then we'll do closing? Or is that, Kathleen, do you have a different preference?
No, it's fine. I'll stay as long as there are questions to be answered.
We have a constituent who's asked this question a couple of times, so
Sure.
I want to make sure that it's asked, and
Sure.
if we can't get the answer, then she can email. But she wants to know the difference between the terms equity and equality and whether they're defined in the code.
It's interesting. We have been using those terms a lot. I think equity is as I understand it, the way we've been using it has been sort of an allocation of resources in a way that sort of brings everybody up to the same starting point.
It's even.
So if you have a community that has 70% of the children on free and reduced lunch, maybe more resources need to go to that school system, or they need to have smaller class sizes, or they need to have some wraparound services more so than another school system that doesn't have such a high percentage of children on free and reduced lunch. So equity would be sort of giving each child, the resources or opportunity to succeed. And that might mean an allocation of resources that, addresses poverty and has to make up for some other lack of resources in the community. So that was how I'm viewing equity. And equal opportunity, I think, is more, making opportunities available and acknowledging that these opportunities are sometimes not always available to every group, and so making an effort to address that. I haven't really seen a definition in our code of,
No.
and if there was a definition, it would be within a certain context of that code as opposed to a blanket definition. But we certainly will be looking into that. I know that this past session in the past two sessions, we've taken giant steps in removing references to Jim Crow language and context in our statutes.
No, I think we are looking for equality of opportunity and
I want to say I don't want to say I'm an expert on this. So if our listeners are, more informed on these concepts and have some background information, that would be helpful. Please send it to us. We're using this as a, we're trying to grow, we're trying to learn, and we want to, make some transformational changes. So all of our communities feel empowered and able to succeed.
I can tell you that the one thing, having been in this now for 7 years, and Barbara the many years, is that a lot of people don't really know how the General Assembly works, and that we put our bills all in by the 1st of December. We get so many people who will come to us in January with a great idea, but by then it's too late for us most of the time to file a new bill. So these are things that we need to really be more teaching our community more how to get a stronger voice in what goes on down in Richmond. And I'm always disappointed when someone will come to me with a great idea or a great bill idea and have us, be the 1st of February. and just no way. It's not like the US Congress where you can offer a bill anytime.
Yeah, that's a great point. I mean, it's always better to talk to us off session and give us an opportunity to, research your idea and find out what other states are doing, and allow us to get the bill in before the final deadline, which is what Kathleen's talking about. We always have an early bill submission date, and bills seem to have a higher percentage of success when you can get them drafted earlier and you can have all the stakeholders look at it and you can work through some of the issues before the General Assembly even hears the bill. So that's great advice. I think we should just move into our closing statements. You think so?
Sure.
Do you want to go?
No, I just want to thank everybody for being on this. This has been a really hard time for all of us being isolated in our homes and not being able to be out and talk to you in person. It's kind of lonely actually around here because I don't have young children running around. But I would tell you that I appreciate hearing from you. I value the calls and the letters that I receive, and appreciate the ideas that people are proposing and the concerns expressed over vaccines and to make sure that we all can stay healthy. We work really, really hard to make sure everybody gets an answer. Nobody is left behind. Everything we do, though, I have staff, and my staff is in Richmond, and I'm up here in Northern Virginia. It's not easy. And so if it takes us a little bit longer, I hope that you will understand. It isn't that we're not trying. It's not that we are not interested in addressing an issue. It's that it just takes longer for us to have to navigate all that we have to navigate, from afar. I love this district. I've been very proud to represent the people of this district. And this is an election year, and I hope you'll continue to support me as we move forward. But either way, I am working as hard as I can to make sure that the issues that are important to the people of the 34th District are addressed in a positive and productive way. So thank you.
Good closing statement to Delegate Murphy. I just want to say I'm always hopeful. There's always a new day. We may not have fixed every problem, but there'll be opportunities. There'll be opportunities for us to go back and work at additional issues. I too enjoy representing this district. Unfortunately, I'm very fortunate. I feel that my values converge very nicely with the voters of this district. So it is an honor and a privilege to represent you in Richmond. And I do appreciate the fact that you continue to contact my office, and we will be as responsive as possible. So thank you. Again, stay hopeful. There's always a new day. We're right around the corner from this
In touch.
COVID,
We're here.
from this COVID emergency that we're under. So please stay safe, stay well, get your vaccine, and in the meanwhile, continue to wear your mask and enjoy yourself as much as you can. Thank you for listening, and thank you for participating.